Since the passing of Lee Collins shocked football's community, there's been an outpouring of tributes to the man who was just 32 years old when he died. Lincoln City manager Michael Appleton knew Mr Collins from his time in the West Midlands, when Appleton worked at West Bromwich Albion and Collins was a Wolves player. He said the news saddened him.
It was tragic news when I found out. It's never nice when people pass away at the best of times and have a full long life, but to sort of lose your life at such a young age, you never know what's going on in people's minds, in people's heads.
While sport is beneficial to one's mental health, there's a lot of pressure on professional footballers. The sport is competitive, there's huge money involved, and with players under the spotlight, one bad day at work could see you end up as public enemy number one. But the real elephant in the room is men and how they may handle mental health problems. Dr. David Creepay-Key from the Mental Health Foundation said that in 2018, 3/4 of suicides in the UK were men.
Men's mental health is an enormous problem in the UK. Collections of men are not necessarily environments that foster constructive, positive discussions about mental health. We often find in those kind of environments that any kind of discussion around mental health is seen as talking about weaknesses, as disabilities.
Pressures on players and a stigma around men speaking up about their mental health makes for a difficult environment in football. Michael Appleton thinks personal discussions need to be much more common.
Mental stresses and strains on sports people and people in general life has to keep coming to the forefront of everyone's thoughts and processes, because people need help. People deal with stress and strains in different ways, and if that's by helping people to come out and talk and speak and be available, then so be it.
Over the last few years, campaigns have been launched in the English Football League, like working with the Mind charity. But Dr. Creepay-Key said more needs to be done.
Football as a sport has quite a lot of work to do. What's important is that when a club starts to notice that somebody's mental health is not as good as it should be, that the environment is positive to enable people to address that as quickly as possible.
The doctor added that you should reach out if you're struggling, regardless of if you're a man or a footballer. The death of Lee Collins shocked the football community. Now, the sport will try to prevent it from ever happening again.